exam itself, I just have a few gentle questions. It helps me get a better sense of your eye health and any concerns that you might have. So firstly, can I just confirm your first and last name, please? Okay. Thank you. That is such a lovely name. So, what brings you in today? Is this just a routine checkup, or have you been dealing with any specific issues? For instance, have you noticed any dryness or maybe some strain from looking at screens? Yeah, so many of us are feeling that lately. Have you been having any headaches, itchiness, anything at all? Just let me know. Okay. Yeah, thank you for sharing that. And do you currently wear glasses or contact lenses? And if so, how often would you say that you wear them? And when was your last prescription updated? It's totally fine if you don't remember the exact date. Just a general idea is perfect. Have you had any eye surgeries in the past, or any significant injuries to perfectly aligned. Wonderful. I'm just going to gently feel the area around your eyes. I'm just checking the bone structure here. Just relax for me. Just applying the softest pressure. You're doing great. No tenderness or discomfort there, is there? Okay, good. Wonderful. Okay. Now, if you could gently just close your eyes for me. I'm gonna take a peek at your eyelids. I'm just observing the skin, making sure it's healthy. Your lashes are growing in the right direction. No signs of inflammation. Everything looks perfectly calm and healthy. Alright, you can open your eyes again. Now, I'm gonna ask you to look up at the ceiling, just with your eyes. Okay, perfect. I'm just gently pulling down your lower eyelid to check the conjunctiva. I'm looking for a healthy pink color. Yes, that's perfect. No signs of dryness or irritation. Now, can you look down toward the floor for me? Excellent. I'm just checking the upper portion now. Again, everything looks wonderfully healthy. Okay, you can look straight ahead again. That was perfect. Okay, now for the next test, I'm going to be using my penlight. It's just this small, gentle light, and I'll use it to check how your pupils react. This is a very important reflex. Before I even turn it on, I'm just going to observe your pupils in the current room light. They look nice and round, perfectly equal in size. That's a great start. Now, I'm going to turn the light on. be watching your left eye. Both pupils should shrink together, even if only one gets the light. It shows me that the nerve pathways between your eyes are working correctly. Okay, so just relax and look straight ahead. Here comes the light into your right eye. And I'm just watching your left eye. Yes, it's perfect. A lovely consensual response. The left pupil constricted just as much as the right. Okay, now the other way around. I'm going to shine the light into your left eye and watch your right. Yes, smooth and precise. There's no problems there at all. Just one more little test while we're here. This is to check your convergence, the ability of your eyes to turn inward to focus on something up close. So what I'm going to do, I'm going to slowly bring my finger toward your nose. And I just want you to keep your eyes locked on the tip of my finger for as long as you can. It might feel a little strange. You might even go a bit cross-eyed. And that is perfectly okay and normal. Okay. Here we go. Watch my finger. So I'm moving it closer, closer, closer. Keep focusing, keep focusing. Good, good, good. And relax. That was perfect. Your eyes converged beautifully and work together exactly as they should. You can blink a few times, that's fine. Let me just make a quick note of that. Okay, now I'm going to check your peripheral vision, your side vision. This is called a confrontation field test. First, I'm going to have you cover your left eye with your hand, and I'll cover my right eye. So we are mirroring each other. Okay, good. Now look straight at my open eye and don't let your gaze wander. I'm going to hold up some fingers in your side vision. So just tell me how many you see. Okay. Ready? So just keep looking right here. Okay. How many fingers are there? Good. How about now? Good. And now? Perfect. as you see them wiggling. Alright. Ready? So just look straight ahead, right here at my nose. Good. Perfect. Great. Just keep staring at that spot, finding the red reflex again. Excellent. And moving in a little bit closer. You're doing so well. Just a little bit longer. Alright, I have a very clear view. Again, looking at the optic nerve, it looks just as healthy as the other one. Nice, sharp margins, tracing the blood vessels. They branch out so beautifully. Wonderful, just scanning the retina, making sure that there are no abnormalities. It all looks perfectly healthy. Okay, I am moving back now. And we are done with that test. You can blink, let your eyes adjust. I'm going to just bring the lights back up, okay? Okay. That was probably the most intensive part, and you did it wonderfully. Everything at the back of your eyes looks completely healthy and normal. And with that, our examination is complete. You did an absolutely fantastic job. Now I'm just going to take my gloves off and write up my final notes. Okay. Perfect. Well, I'm very happy to report that your eyes are in excellent condition. Everything we looked at today, from your pupillary reflexes to the health of your retina, is exactly as it should be. All the tests came back with perfect results, so you have no reason for any concern. And regarding the eye strain you mentioned, that is incredibly common. I would just give you some simple advice. Remember to follow the 20-20-20 rule. So that's every 20 minutes that you're on a screen, try to look at something that's 20 feet away for at least 20 seconds. Yeah, it follow up.